Thank you for joining us here today. I wanted to start by recognizing and thanking the role of a government leader. Leading a government is very difficult job. The responsibility to protect and serve the residents, the people, is all consuming. And we see this every day in the eyes of our governor, in his speech, and how hard he works to serve the people of New York and to protect us. Right below this level of government, the state of New York, are the regional governments. The county governments are regional governments who are carved up into 57 regions of the state of New York. I'd like to thank the two county executives that are with us here today, the Onondaga County Executive, Ryan McMahon, and the Ulster County Executive, Patrick Ryan. Each is joining us in their first elected term to serve in a regional government capacity. The County Executive of Ulster, Patrick Ryan, comes to us as a military officer graduating from West Point and had created a small startup tech company before he took the job as a county executive, and ultimately that company grew to over 150 employees. The Onondaga County Executive, in his youth, dedicated himself to public service, serving in many capacities, both at the city and county level, ultimately becoming the county executive, and both are very innovative and creative in their first term of government. So let me welcome Patrick Ryan and Ryan McMahon. Good morning.
Morning.
Morning, Steve. Thanks.
Okay, thank you for joining us. Let me start with you, Patrick Ryan, the Ulster County Executive. Tell us a little bit about Ulster County, New York. Where is it located? Tell me a little bit about life in Ulster County right around this time of year.
Well, we're the best county in New York State, obviously. No, thanks everybody for joining, and thanks Steve and Ryan. Good to see you virtually. We are really right on that, what I'd say the exurban extension of New York City. We're about 75 miles north of New York City, so we're not a bedroom community, a suburban community, but we do have significant ties to New York City. So as COVID started to grow in the New York metro area, we did see we're basically a week to maybe 3 weeks behind the progression of COVID here in Ulster County. In terms of how the county has fared versus others in the state, we are really on the top 10 of counties impacted in terms of number of cases, and from a per capita perspective, unfortunately, we're near the top as well. We've really tried to be proactive about our response, and what I think is most key for folks to understand is that, especially in New York State, county governments are on the front lines of COVID. We are running 24/7 emergency operation centers. We've in Ulster County, which has about 180,000 residents, we've built 3 mobile testing sites on our own, working with our hospital partners. We're, as a relatively small, medium-sized county, directly procuring PPE from China, which is something I did not think I'd be doing in my first term here, 6-9 months in. And we're rapidly staffing up contract nurses to have much more medical surge capacity. So Steve talked about kind of the need to be innovative. I think, frankly, being new was an advantage for me in that I wasn't wedded to old ways of doing things per se, and we were able to really use the data to inform our response and listen to the public health experts. One of the things that I've been talking about, which I think is relevant to this conversation, is because counties are on the front line and because we're bearing significant cost, which we're happy to do, and of course we need to do to protect our public and our residents, we need help. We're going to have a huge financial hit, both from cost but also in reductions in revenues. And I believe that the next round of federal support absolutely has to include direct funding to the county level of government. The last COVID bill, the CARES Act, was a good first step. It provided some state and local support, but in New York State, 53 counties received no direct aid. Any county under 500,000 residents received no direct aid. So in the next round, I believe that it's absolutely critical and frankly existential that we receive that every county receives direct support to help us cover the work that we've been doing and the work that we're going to have to continue to do. And happy to talk, and answer questions, but really appreciate having the chance to speak with you all.
Thank you. It was Patrick Ryan, the Ulster County Executive. Let's go a little over 210 miles or so, a little over 200 miles west into central New York, an area of the state where the governor has talked about somewhat stabilizing in the number of infection rates and somewhat stabilizing in the number of hospitalizations. And let's talk a little bit with County Executive Ryan McMahon. Ryan, you came out very early with some very powerful executive orders. Of course, being a chief executive, similar to a governor, a regional leader such as yourself has executive powers to use and implement executive orders. You put down an executive order in the best interest of your people in social distancing, asking them, it wasn't a mandatory order, but it was an order asking them for extra help in sort of the way that they go out and get their needs, the way that they shop, the way that they recreate, the way that they get their medicines. Can you talk to us a little bit about the success and your thoughts about that?
Sure, and I'll give you a kind of a quick shot where we are today. We've seen, and Patrick will understand this, but essentially, it's not just your cases you have every day of COVID. It's trying to understand what the cases are, where they came from, so that you can really respond in live time. So we've been making tremendous progress as a region. Certainly, being in the middle of the state has helped us with that. It's harder to get to us, but we are a 3-hour drive away from New York. We're a 30-minute plane ride, and we have numerous flights each day. But essentially, in the beginning of this process, our cases were related to travel, essentially from New York City, and then it became community spread. Right now, at the back end of this, we have new cases each day, but our community spread cases, which is really the randomness of this infection in the community at large, the risk for the whole community, have been going down in really high percentages each week. And what we've been able to do is we've been able to actually do proactive testing. We're doing proactive testing in all of our senior communities, specifically targeting buildings that we knew they had a case in. So now what we're doing is we're finding more positive cases of asymptomatic individuals, and we're getting them quarantined because they still have risk to infect others. So how did we get to the point where we are today? To your point, we essentially were planning and preparing for this virus in February. We received our first positive case in mid-March. We started implementing mitigation tactics and techniques before we had positive cases. We shut down schools before the state. We shut down our Destiny USA, 6th largest entertainment shopping center in the country, which was painful to do that because that's where our revenue comes from. And then what we really saw is we saw the first few weeks the community really responding to social distancing, but then it was almost looking like we were getting comfortable with the virus in our community. Some of the contact cases we had or affiliated cases we had were kind of decisions that people really should have known better. So we rallied the community, and we did a 2-week voluntary shelter-in-place order. And what we asked the community was, based off of the year of their birth, was to change their shopping and commercial shopping patterns. So if you're going to go to a drugstore, you're going to go to the grocery store, you're going to go use a park, do it on every other day based off of the even year of your birth or the odd year of your birth. And what we saw, it was really a rallying cry for the community to participate in a way that gave them some direction. And it really helped us. What we saw after we made that order, it's difficult to really compare COVID data because it's so new and fresh. But what we did is we compared our respiratory illness data from last year. So we looked at influenza A and B cases when we started social distancing. And then we looked at it with the voluntary shelter-in-place orders. And for that 2-week period, week over week from that order specifically to the same week last year, we went down to 0 influenza A and B cases. So we were starving not just COVID-19, but we were starving these other viruses as well. And our COVID-19 cases, when it related to community spread, dropped 20% each week. So now we're in a boat where we still have testing capacity. We want to go find this virus because if we know we do that, we'll save lives. So we're still getting positive cases, but they're in contained areas or hidden pockets of the community, and we're able to really help protect our vulnerable.
Thank you, Ryan, the Onondaga County Executive, Ryan McMahon. Let me go to you, Patrick Ryan, the Ulster County Executive. You were a very early leader working in a regional capacity. The Mid-Hudson Valley includes Dutchess County and Orange County and Ulster County, this triangle, if you will. You were very early on leading together as a region. And I'm going to go back to Ryan McMahon in a minute and ask him about his role in a regional re-emergence strategy that the Central New York team is working on with Oneida and Onondaga County. But let's go to Patrick Ryan and talk what it was like to work as a region, because your early work, working in a regional manner, could play itself out in a very beneficial way to re-emerge as a region when you're able to keep those infections down and the number of hospitalizations. Can you talk a little bit about what it was like to pull in the regional partners and work together?
Absolutely. I think I mean, we're a massive state. It's very important that we operate in a regional manner and make decisions informed by what's happening actually on the ground, the data we're seeing, the public health data, and knowing our economies and how that all interplays. Early on, particularly between Ulster County, Orange, and Dutchess, which together are well over probably 1.5 million residents. Check my math on that. We were particularly concerned early. We had our first case in Ulster County on March 8th, and we were very concerned about schools and wanted to move quickly on that. And so I reached out to my regional partners, County Executive Mark Molinaro, County Executive Steve Newhouse, and we said, look, we think if we act, all the data, all the epidemiologists say that schools are one of the most critical vectors, not just for students, but for teachers and parents. And so we made that decision, as Ryan McMahon said, early, ahead of the state. And we believe that even just a matter of days of doing that more quickly undoubtedly slowed the spread and saved lives. And I think that's a perfect example of how, you look at your knowledge of what's happening on the ground, you make that decision. And so we made all these tightening and winding decisions together. Now, how do we unwind things together in a regional approach? I agree with what the governor said, that it needs to be a regional approach. And so one specific thing that we announced actually here yesterday, our overall plan, we're calling an economic resilience plan here, really about recovering, reopening, and realigning. But one of the core things that we're doing that I think will be, I imagine you guys are doing as well, County Executive McMahon, is we're convening industry-specific working groups with our leaders from business here to think about, at the very granular level, how do you reopen quickly but responsibly and safely, actually informed by the knowledge of the unique aspects of the businesses and the community. So I think that's a perfect example of how regions and particularly counties working together can cooperate to safely unwind the situation that we're in.
Thank you, County Executive Ryan from Ulster County. Let's go to Ryan McMahon, the Onondaga County. Again, working in a regional manner, no county executive from across this state is asking the state of New York or the federal government or any other level of government to open up its borders, its region, without doing it in a safe, responsible manner, and to re-emerge as a stronger region. Onondaga is leading this effort in Central New York, working with perhaps about 10 counties at this point in time. Can you tell us a little bit about your plan as we work through this regional re-emerging stage of the COVID-19 virus?
Yeah, similar to what Patrick was talking about, you have to do these things regionally, and we've all been impacted differently in each region of the state. So that may determine our timelines. Right now, our hospitalization rates have stabilized. Our infectious rates were actually some of the best in the state because of probably where we are as much as some of our mitigation techniques. But we've worked with both the central New York region, so we're talking about Cayuga County, Madison County, Oswego County, and Cortland County. But we've also teamed up with the Mohawk Valley region, and specifically Oneida County with County Executive Picenti, because we're all connected. Our economies are connected. People are coming in and out of our communities each day working. And when you think about Restart, this is where we're unique in New York compared to other states for the federal government. You can't have a restart without county government. A restart is really our ability to start to opening up business with our local health departments, based off our local health department's ability to fight the virus in real time. So we have to lead on Restart. And then that goes into the next phase of economic recovery, which then certainly the mayor of the city of Syracuse and myself put together an economic resiliency task force. We have a flow chart now with our Central New York and Mohawk Valley Restart, and certainly the regional economic development councils will play a leading role as well with economic recovery. But when you look at what we're doing, Steve, there's the plan for Restart, a phased-in approach that essentially brings back more density into our community. Essentially, we're testing this virus and giving it opportunities to feed again based off of our health department's capacity. And so it's the actual plan. What does phase one look like? What is phase two, phase three? But what is important is what triggers the plan, the when. And so certainly we saw the governor speak more about it yesterday and give more ideas of what the governor is looking to see. We actually had many of those benchmarks in our plan already, so we're very comfortable and we agree with the way the governor is approaching this. But that's what this looks like. We believe that with our data where it is, our hospitalization rates where they are, our ability to surge because of our great medical infrastructure, that we're ready as a region. And certainly we agree construction and manufacturing are good places to start. We think each region may have different specific economic sectors that maybe you could plug into that phase one as well, based off of each region and the ability to social distance within those sectors. So that's the dialogue that we'll start to have with the state of New York at this time.
Okay, I've got one last question for each county executive, and then we'll open it up to the media partners that we have with us here today to see if some folks around the state have some questions. Ryan, I'm going to ask you when I come back to you about hospitals and elective surgeries and what that means in Central New York and York County. And I'd like to talk to County Executive Ryan about contact tracing and efforts of the county is doing, the capacity that the county has. If we look at about what's happening with revenues right now, the revenues shock, if you will, to Ulster County and to the counties around the state is right there with the state of New York. The severity of this fiscal situation, the amount of sales tax revenue that we will lose, the amount of hotel occupancy tax revenue that we will lose. Ulster County is a leader in tourism, outdoor hiking, people coming to enjoy the great outdoors and the other attributes of Ulster County. There's going to be a revenue loss, which is why you've been asking the Congress to fund this revenue loss and help you. Contact tracing is going to be expensive. Ulster County does this right now, as do all the counties of the state. Can you tell us a little bit about why contact tracing and further efforts to isolate really make a difference?
Absolutely, and building on what Ryan said, and sorry we got Ryan and Ryan here, very confusing for everybody. But building on what Ryan McMahon said, the other key piece, which is tied to contact tracing, is testing, both in terms of understanding the spread of the virus and where we're at in terms of the public health, but also equally as importantly to inform our reopening. Testing needs to ramp up significantly. I mean, we have been pushing very, very hard to set up these testing sites. We've now tested, I think it's 3.3, 3.4% of our population. That's not, I mean, we know from the public health experts that is not adequate, and that's diagnostic testing, to be clear. That is not going to be adequate to really inform an accurate picture of what's happening on the ground. And so that's one of the places that I know the governor and his team are working on, and that we continue to need help on more diagnostic testing as well as antibody testing. And that all ties into your question, Steve, about contact tracing. The way that we are thinking about that, and I spent a lot of hours yesterday with my team going through our contact tracing plan for really this next phase. The idea is that as we begin to open the valve and loosen things up carefully and deliberately, it's critical that we have really sort of an alarm system in place so that if we see another outbreak or a little pocket begin to reemerge, that we can very quickly identify it and rapidly react and contain it. Frankly, this is what ideally we all would have done when we first learned about this, but we were so behind that I think we really weren't able to effectively isolate in the beginning. And now this is an opportunity when we reopen to do that more effectively. So contact tracing will require significant, it's just tough, time consuming work of really almost detective work of going through and tracking down people's movements and contacts. And there's really no shortcut to doing that. It will be labor intensive and costly. And that's another cost that will ultimately be borne by counties, things that we absolutely don't have the budget for, and we'll have to make it work. And so that's another example of where we will need funds and we'll need help. And we're ready and willing to do that. We've got the plan in place, but it's not going to be inexpensive, unfortunately.
Thank you very much, County Executive Ryan. Last question, and then we'll go to the media. Let's talk to County Executive McMahon from Onondaga County. You have two very large hospital systems in Central New York and Onondaga County, Krause Irving Memorial Hospital and Upstate Medical, two very large hospital facilities, thousands of employees on furlough, laid off, very important economic engine, but also a very important healthcare system set up in Central New York. It appears that your area of the state, the Finger Lakes and the Southern Tier, might be in a position where elective surgery might be able to begin commencing. The governor, of course, being in Onondaga County yesterday, talking about this a little bit. Can you give us your perspective on this industry?
Sure. So we've been known as an eds and meds economy for a long time, and we certainly have diversified that in the recent years, which has helped us with our economic growth we've had. But right now, our hospitals, besides being part of our emergency management response to COVID-19 and really helping treat people, and you look at some of the death rates we've had in our county, we've had success there because of these hospitals and their ability to do their job well. They're the economic backbone of our community. And so certainly, as we went through the beginning part of this fight, we had to ramp down medical activity, mainly elective surgeries. Now that we've had a lot of success and our hospitalization rates have stabilized and have decreased, and our room capacity, our bed capacity is tremendous at this point, not just for Onondaga County, but for the whole region. We're ready to get that going again. And so elective surgeries will be able to begin again for our hospitals. We'll be able to bring back workers. It will free up some supply chain activity for other parts of our economy. And remember, elective surgeries, these are people who are hurt. They just had to they couldn't get a very important procedure to them and their quality of life done over the last period of 6-8 weeks because of this virus. And so really, when you look at the public health overall, this is a piece of public health that we're getting residents proper procedures, at the same time getting people back to work and kind of being an early part of really loosening regulations, which helps phase into a restart of other industries.
Thank you very much. Why don't we see if the media partners have some questions at this point in time, respecting everyone's time. We're very grateful to have the Onondaga County Executive, Ryan McMahon, and the Ulster County Executive, Patrick Ryan, with us here today as part of our series on counties lead during the COVID-19 crisis. Thank you very much, gentlemen. Mark, why don't we see if there's some questions?
Thank you, Steve, and thank you, county executives. At this time, if you have a question, I would ask you to raise your hand in the participant panel. If I see no hands, then I will go through all of the participants or the reporters on the line and unmute you and ask you if you have questions. We now have one question from Dan Clark. Dan, you're unmuted.
Hey, county executives, can you hear me okay?
Yeah.
Hi, guys. I'm curious, and sorry if you touched on this. I had to jump off for like 5 minutes. I'm curious as to whether you've kind of started preparing in your own departments for a potential second wave in the fall or an overwhelming of the hospital capacity from the flu system, what that looks like in your county, if you're already looking ahead to that, or if you're still kind of reeling from what's already happened.
Yes, I can jump in, and Patrick as well, but you heard Patrick talking about tracers. This is all about our health department having the capacity to essentially identify the virus, test in real time, meaning that we have rapid testing through our hospitals, but right now we have many labs giving us back results within 24 hours as well. And then certainly to trace and then box in. So we're boxing in the virus related to respiratory illness. Part of why we shut down various events in our community, we did not have COVID-19, but we had high rates of influenza A and B early on. So we had to rule out COVID-19 for all those cases. So we shut down our St. Patrick's Day parade because of that and other things very early on. So we're really preparing for that. We had a surge site prepared at Manley Fieldhouse at Syracuse University in the event our hospitals became overrun. We bought ventilators. We bought things we never thought we'd have to do to help build up that surge site if it was needed. It wasn't needed. We're very happy about that. But certainly, we will certainly fine tune and refine many of the plans and that we put together, not knowing now what we know.
And I'll just say I agree with that all, and we've done a lot of the same things, and all of the medical expertise and advice I'm getting from our health commissioner and others is that there will absolutely be a second wave in either the late summer or the fall, and this is an opportunity for us to get ready, learn from what we did previously and do a better job. So we're absolutely doing that while also still responding. I mean, we still have dozens of people in our hospitals hanging on for dear life, and we're trying to contain the spread. So plus we're planning to reopen the economy. So there's a lot of moving pieces here, and getting the timing and the synchronization right is really one of the more difficult parts.
Pat, what do your numbers look like right now? I know that the governor said Central New York might be able to open after May 15th, some areas, but in your county, is it kind of the same? Do you see that decline right now, or are you pretty flat?
So our cases keep going up. We now have over 1,300 cases. We've had 30 fatalities, and we're a relatively small county, so those are fairly high percentages. But the one encouraging sign is our hospitalizations are flat now. And maybe starting to decline. It's a little too early to say that definitively, but we are encouraged by that. I think the numbers in testing going up is because we're testing more people. Similar to County Executive McMahon, we've proactively started testing our senior facilities. And so as we do that, we're actually uncovering significant numbers of COVID positive asymptomatic individuals. For example, one of our facilities, we tested yesterday over 200 residents in a senior facility. 32% of them were positive, and the majority of those positive were not symptomatic. So we still have a lot to learn about this disease and how it's spread, and particularly in more communal settings that I think will inform. But the short answer is we're not quite ready yet. I think it's definitely more acute and worse here than in some other parts of upstate New York.
Thank you. I would remind reporters that are on the line that if you have a question, please raise your hand in the participant panel. We have a hand raised by Amanda Fries from the Albany Times Union. Amanda, you are unmuted.
Good morning, everybody. Thank you, County Executives, for all of this, and to NYSAC. I had a question, hoping that maybe either or both of you can comment on financially. What are your budgets looking like at this point? Is there an ideal number for how much you might need in order to kind of stem the tide from the federal government?
I think we'll both want to talk about this, but
fortunately,
it's not just remember, we have to have balanced budgets. And so we all had balanced budgets going into this process. 52% of my revenue comes from sales tax. So you've heard us all talk about unfunded mandates over the years, but an unfunded mandate related to this is a government telling you you can't operate your economy and then not helping you in return for that. And we agreed with our federal and state partners we needed to shut down to fight this virus, but there needs to be an acknowledgement that we are large employers in our community, just like business. So we need help. But in our county, we started taking austerity measures on day one. We realized we were going to have a gap and that we were going to have to feel this pain ourselves. But certainly, depending on what the state of New York does, before this problem, just based off of new costs and revenue hits to sales tax, we were looking anywhere from $75 to $125 million hole. Now, if the state of New York is talking about passing on 50% cuts to local governments, that number goes from a $125 million to $175 million hole. There's no way that our community can sustain that hit without me laying off massive amounts of employees, which is contradictory to what we're trying to do with an economic recovery. We want people to have a paycheck and spend money. So this is grim, and we're doing things at our own. We already, our 103 lines, which is our part-time lines, we already did essentially furloughs. We've already cut $20 million in austerity spending. We already have gotten a retirement incentive through where hopefully that will save us money by June. But the reality is, if there is not help from the federal government, for local governments and for the state of New York, it is going to be a painful process later on this year.
Just to pile on with the gloom and doom here, the one word that comes to mind for me is ugly. It's going to be really, really ugly. And county governments that are at the forefront of delivering critical services at a time when those services are at higher need than in decades are going to ask to be cut and see budgets reduced, which just does not make sense and is absolutely contrary to what everybody's saying. The numbers here for us, it's hard to project, but our initial projections, which assume about a 17% cut in state aid and a significant loss in tax revenue, have us seeing a 10% overall loss in revenues, which is $35 million in our budget. We're a little smaller than Onondaga County. That would be absolutely devastating. It would require either major service cuts and or furloughs or layoffs. We're taking a lot of the similar measures. Our legislature passed a retirement incentive package last night, but it's going to be really a struggle. Some of the preliminary numbers that were floated for federal relief, and I want to thank Senator Schumer specifically. He has been relentlessly pushing for this and advocating for counties and local governments and state governments against a lot of opposition in DC. Those numbers that were floated, the numbers that I saw in that formula, only cover about half of what we think our 1 year gap is going to be, and obviously we need and will take whatever help we can get. But even that, I think will not totally get us there.
We have a question from Hank Gross from Mid-Hudson News. Hank, you're unmuted.
Hank, are you there?
Hank? Okay, we will move on to Amanda Fries has a follow-up question. Amanda, you are unmuted.
Am I unmuted? Can you hear me
Yes.
now?
Yes.
Excellent. Sorry, I wasn't quick enough to ask my follow-up question to both county executives. Are you concerned about some of the conversation down in DC of there being a caveat of withholding federal funding for states and localities that are considered sanctuary cities or sanctuaries, period?
I mean, this is not a time for the political BS. There should be no caveats. We're on the front lines of fighting a once-in-a-century pandemic. I mean, this is not the time to put those kind of conditions, I believe, on aid that is clearly needed, and that is going to be instrumental to preserving lives, not just the immediate COVID response, but all the critical services for recovery afterwards that county governments are going to need to deliver.
Yeah, I would just say the political poison pills that are so frequently dealt with in DC just need to stop. At this point, we're the ones fighting this virus in one of the states that has been most impacted, and one of the states that's most connected to every other state via just the traffic, the tourism. So we need to get this right here, and we need help. And it's your job to help. I've always said we all have cranky days in this process. I have a lot of cranky days. So I'm hoping that some of these commentary that we read about at times are people just having a bad day, because this is tough.
Hank, back to you. Hank Gross, do you have a question for the panelists?
While we're waiting for Hank, Mark, I'll just add that we are bracing for massive revenue losses. We're now projecting 50% of the casino revenue that local governments and counties, including Ulster and Onondaga, receive presently will be in decline. We're projecting over $1.52 billion in sales tax losses. We heard the impact to each of these county executives about these types of revenues. That leaves the property taxpayers on the hook. And when we're looking at state reimbursement cuts of the magnitude that we've heard, anywhere from a range of $900 million at 20% to a 50% that reaches about $1.5 billion, combined with the loss in sales tax, this double whammy effect, really there's no way the capacity of the local property taxpayers could sustain this. We would see tremendous sacrifices at the county level. All the more reason why the federal government really needs to step in and properly put guardrails on this federal funding and truly getting it to states and counties who were truly impacted by COVID-19 revenue losses. Back to you, Mark.
Thank you, Steve. Hank, one more time, and then we'll move on to Dan Clark. Hank, are you with us?
I'm trying. Can you hear me?
I can hear you faintly, Hank. If you speak, I can maybe relay the question. I can hear you, but vaguely.
All right, I'm talking really loud into the microphone.
Okay.
This is for Patrick. In light of the legislature last night, the county legislature approving the incentive package, and at the same time, the county controller has issued a report suggesting that we might have to lay off hundreds of employees for 3 months. How does he feel about that layoff possibility? Is that going to be needed?
Okay, so Patrick, I'll repeat the question. With the Ulster County Legislature approving an early retirement incentive, at the same time the Ulster County Legislature talking about layoffs, how do you reconcile the two? What are your thoughts about these discussions with respect to the public workforce?
Hey, Hank, and thanks for relaying. Yeah, I think all options have to be on the table in a crisis situation like this, in terms of making sure that we can still deliver critical services and not burden taxpayers who are already under tremendous financial and economic pressure. So my commitment and my goal is to have any layoffs be an absolute last resort, which is why we proposed a retirement incentive, which was agreed upon and suggested actually by our CSEA leadership as a way to try to save costs and not impact our critical workforce, who, by the way, have been working around the clock above and beyond what we've asked of them in the midst of this crisis. This isn't the time to leave them hanging. So I actually didn't hear the discussion from the legislature about layoffs one way or the other, but that, from my perspective, that's an absolute last resort, and we're going to do everything else we can in our power but prior to doing that.
The layoff proposal came from March Gallagher, the county controller, yesterday.
The layoff proposal coming from the county controller, March Gallagher.
Oh, okay. Yeah, I heard. I have not seen that yet, but I think that just happened last night. So I'll take a look at that. I know I have heard anecdotally that some other counties, our neighbor Sullivan County, did something like this, where they did some sort of almost a temporary layoff, putting some of their employees on what I think would be federal unemployment benefits, on UI benefits. Um, to me, that doesn't feel like probably the right solution. That's my initial reaction. But again, we have to look at everything to try to. The number one priority is keep critical services being delivered in the midst of a crisis to the residents of the county. But we have to balance that with the tax burden and with protecting the workforce. So those are the competing forces, and I'm sure both of us are wrestling with how to get that balance right.
Mark?
Dan Clark, you get the last question this morning.
Thanks, guys. So I'm wondering, because I hear you guys talking a lot about the federal government, is there anything that you would like to see the state legislature do to help you guys out during this time? I know that they have the power to stop the governor's cuts when they are officially released. They have kind of a rebuttal mechanism. And I guess they could also approve raises in sales tax if you wanted to go that route. Would you want to seek anything from state lawmakers?
Well, let me start, Ryan, by just saying there is one particular piece of legislation that we are looking for with respect to financing, deficit financing. Right now, we're limited to a 12-month window. We have introduced legislation in there for the legislature to consider that would give us the ability to do more long-term financing for budget deficits in the event that we need that flexibility. So that one piece of legislation we will be asking for. The other one is to allow counties to work with their IDAs to issue small business grants to the small business community to supplement the federal Small Business Administration grant loan programs to help keep small businesses staying open. Ryan McMahon, I'll turn it over to you.
Yeah, I think, Dan, that's a great question. Flexibility is what we need. And for too long, the reality is that we are regional governments, and we do many different things. We're essentially an extension of state government. We do the exact same things. Patrick and I every day have the exact same departments that we have to oversee that the governor has. So giving us flexibility, specifically, Steve referenced IDAs, that's critical. To give out loans to help small businesses that aren't getting support through some of the PPP programs. But you brought up sales tax. We can't go back and raise property taxes right now if we wanted to, and many of us don't. We have no flexibility right now but to cut. So the state should look to give us more flexibility, or this issue of pushing on cuts to local governments will boomerang back at them. So certainly flexibility related to sales tax and our ability to deal with that more from a regional standpoint would be something that we would be at least interested in exploring.
Yeah, I would second that and agree with the general idea that the kind of the old ways of doing things are not going to work, both in terms of the speed. I mean, we're going to need to be able to turn things more quickly and have a much more free-flowing dialogue between all levels of government, and really want to see the willingness to let us try new things if there's a great idea. Maybe some ability to sort of almost pilot new approaches as we deal with how to all operate at every level of government with more more things we need to do and probably less resources to do it with. That's going to require some new thinking in all kinds of services and things that have been very kind of rigid and inflexible and tightly controlled. And I think that one of the ways out of that is a little bit of a willingness to decentralize and let folks experiment, try new things. One of the interesting discussions to me is prior to COVID, there was a lot of discussion about the Medicaid program, and the counties had gotten together, and I know we had done some really in-depth thinking about ways that we might be able to actually help reduce costs if given more control and flexibility to do so. there are lots of other similar programs that I know I would be very excited to participate in, thinking about how we can do them better by shaking things up. But that's going to require an appetite to do things differently, and we're definitely ready to do that, and would love to see the legislature as a partner in that.
Let me thank Ulster County Executive Patrick Ryan and Onondaga County Executive Ryan McMahon. This is part of a series of counties' lead stories during the COVID-19 pandemic. Thank you very much for your public service. Thank you for saving the lives of New Yorkers, and thank you for helping so many around the state work together as we combat the COVID-19 pandemic. That will conclude today's press conference. This recording will be made available on the NYSAC website or NYSAC TV, and also on YouTube. Thank you very much for joining us today.
Thank you. Stay healthy, everybody.
Yeah, Pat, stay strong, brother. Take care,
Yeah.
man.
Great job. Good to see you.
Thanks, everybody.
Thanks, Steve.
Thank you.